The first generation of systems were deployed in the 90s. They had client-server architecture. They were really designed as sort of a one-way stream of very standardized clinical information into a highly regulated market. And frankly, they didn't have a whole bunch of a whole lot of impact. Those systems were, you would send out, for example, letters to patients. So every diabetic would get a 2-page or 1-page letter that said, get an A1C, watch your weight, watch your diet, etc., etc. And most of those would just end up in the recycling bin because nobody really reads that kind of thing, and the small percentage that did read it probably didn't do much about it. There were also nurse helplines where you could call, but primarily used more for administrative kinds of purposes. Not many people with chronic conditions would call those and say, what should I be doing? How should I be taking care of myself? This was the first decade or so of care management, very expensive, a lot of human resources involved, many thousands of nurses involved in those kinds of outreach purposes, but without a very large impact or any significant impact for that matter on the health of the populations being managed.